Good afternoon, everybody, and welcome to our webinar this afternoon on the Master of Clinical Health. My name is Chloe Lacey. I work in the faculty recruitment team for medicine, nursing and health sciences. Joining me today is Professor Danny Liew, the course coordinator for the course we're discussing today, and Maida O'Keefe, I didn't want to get it wrong, Maida, is a program coordinator and is able to assist with questions as they crop up today as well. So before we formally get started with the slides, I just wanted to ask all participants to please raise their hand. There's a little raise your hand button to indicate that you can hear what we're saying. So you can click that for me now. Hands are popping up, fantastic. Thank you very much. I also wanted to draw your attention to the Q&A button. So there's a chat option and a Q&A button. I'd like you to please use the Q&A button. Feel free at any time throughout the presentation to start typing your questions in as you think of them. We're going to answer those at the end. So Danny's going to start with a formal presentation, then we'll circle back to your questions. But if you use chat, I won't be able to see them, so please do use the Q&A. Otherwise, I'm going to hand things over to Danny. Thank you.
Thanks very much, Chloe. Welcome, everybody. Thank you for dialing in to this webinar. I'm very happy, very proud to be presenting and talking about the Master of Clinical Research at Monash University. Just a few slides to provide some background to the university, our school, and the course itself. And then, as Chloe said, very happy to take questions. So the course, the Master of Clinical Research, is housed within the Monash University School of Public Health and Preventive Medicine. It is one of the world's largest public health schools. And our main campus at the Alfred Hospital in inner Melbourne, just south of Melbourne. But we do have campuses also at Clayton, at Monash Medical Centre, Kingston with an ageing research centre, and South Bank, which is the home of our Victorian Forensic Medicine Institute. We're a very, very large school, over 1,200 staff. It makes us larger than most faculties in Australia, in fact, because Monash is actually a very large university. Over 2,000 undergraduate students, over 800 postgraduate students, and obviously we're hoping to add you to that pool. And we're very research intensive, as is typical of the university and our faculty. We have over 800 publications a year and $40 million of research funding and over $100 million budget overall. So a very big organisation. And our focus is obviously on public health research, but also clinical research, which I'll talk about a little bit. So we're located at the Alfred Hospital campus predominantly, as mentioned. That little circle there at the bottom in that map of Melbourne. We're about 4 kilometres south of the Melbourne Central Business District, co-located at the Alfred Hospital, which is a very highly specialised hospital that services Melbourne and also Victoria and a couple of other states in terms of very specialised services. And there are other research organisations co-located with us. Other than the Alfred Hospital, which itself does a lot of research, there's Monash University, of course, and then the Baker Institute, which is a heart and diabetes research institute, and the Burnett Institute, which is focused on international health and various other infectious diseases. So we're very lucky to be co-located with very strong partners, both in research and in education. And that's the kind of experience that we hope to deliver for all our master's students, this co-location and embedding in such a strong environment. The School of Public Health and Preventive Medicine does a very, very broad range of activities, research, advocacy, and education. And this slide is an attempt to summarise some of that, but to be honest, it probably won't do our school much justice, just such as the breadth of it. But as you can see summarised in this slide, we do involve ourselves in population, public health, including global health, and very clinically oriented research, including clinical trials and clinical registries. So it's not just a very typical clinical trial environment, but we do undertake real-world evidence research as well. So in other words, we do take data, for example, from our health services and analyze that. And then we're interested in health promotion and also health policy, law and advocacy as summarized in this slide. And more recently into public health genomics as well. So as you can see, this is a very big school that does a lot of activities right across the breadth of human health. Monash prides itself in our teaching. We do involve world-class academics and clinicians to teach. So with the Master of Clinical Research, we do, for obvious reasons, include people who have a very strong clinical focus and a clinical profile. And most of our teachers have some experience or do have clinical backgrounds, and that adds to that profile or insights into our teaching and our content. And it is a cutting-edge sort of environment in which we work, and that's both in terms of the research that we do as well as that clinical practice. All of our programs really is catered towards busy people who work mostly full-time, but also we obviously accommodate people who want to undertake these programs full-time as well. It's very flexible, and that comes in the form of having a lot of our content delivered online, both in live as well as in an ongoing engagement process offline. We are very collegial. We firmly believe that this is a key to our success. And of note, importantly, for clinical research, Master of Clinical Research, the opportunity is present to actually undertake a research project yourself. And indeed, for the Master of Clinical Research, this is a compulsory element of it, and that would make sense. But even in other programs like Master of Public Health, opportunities exist for research. This slide here is a summary of all the programs that's housed within our school. I've highlighted the clinical research in red towards the bottom, and just to indicate that there are exit options for students should they wish to do so, and exit with a graduate diploma or graduate certificate, depending on how many units they acquire, and right through to the full master's qualification. The summary of the units that students will enroll in and undertake is on this slide here. And so it really comprises two parts. The first part is the core, and it is about imparting knowledge that are core skills to a clinical researcher. And then part B, the second part, a third of it in a 72-point program, is really application. So it's about applying your knowledge to mainly a research project. And to emphasize again, it is something that we are very conscious of, that it should cater to people working in busy clinical environments or indeed other clinical research environments. And Kate Markey on the right there is a recent graduate whom I met personally through a couple of units that I taught, and I think her experience exemplifies what we're hoping to achieve, and Kate fell on to a research career once she finishes her training in clinical hematology, which I think she's done already. So to dig into a little bit more detail, so the first part, this is part A. As mentioned, it is about imparting core skills in clinical research, and there are 8 units, 6 points each to complete for this part, and they are listed there. And you can see there that it is the first 4 units are really about epidemiology, biostats, and methods for undertaking clinical research. And then the next 3 core units are more practical with data management, and then not so much practical, but a combination of practical and theory would be clinical trials and systematic reviews, which many of you would be aware, is a tool, a very common tool for clinical research. Why I've included there near the top for the first two units, about a 70% mark or above, is that the second part, which is the application, involves for half of this section an advanced health practice research unit, and this is actually a 2-unit, it's double typical points, so it's 12 points. And the criteria or entry eligibility criteria is actually a 70 plus mark to be attained for intro epidemiology and introductory biostatistics. And that's because the project is going to be something that the student under supervision will need to have or to carry forward him or herself. A lot of it would require data analysis and a very firm understanding of the principles. And we felt that it was important that the students attain that minimum mark to succeed in this. We've had this criterion now for about a year and a half, and it actually has served us, or served the students very well. A very successful projects undertaken thus far, including some that have been published. And then for both Parts A and B, as you can see, there are 4 elective units throughout. We tend to suggest elective units for students, but to be honest, there's some flexibility in it, and if students felt strongly that they wanted to undertake a particular elective unit, as long as it fits broadly within the intent of the program, I'm generally quite flexible with the elective units that students can undertake. And I mentioned before that they are optional early exits, and the first of which would be the Graduate Certificate of Clinical Research, and this would only require 24 points, that is the 6 units, and these would, the 4 units rather, and these would be the 4 core units as mentioned in Part A. And then if students were to go on to another year of study or take on another 4 units, then they can choose to exit with a graduate diploma of clinical research, and that would constitute the Part A component of the program that I spoke of before. So that includes clinical trials, data management, and systematic reviews, and then 1 elective on top of the top 4 units there. There are 2 entry levels for the Master of Clinical Research, and the more common one, or at the moment, is entry level 1, and this would be 72-point master, so the equivalent of 1.5 years of part-time study. I beg your pardon, 3 years of part-time study, and that would be Part A and B that I've spoken about up till now. Relatively new to our program is a entry level 2, and this would be a constitute only Part A. So in other words, students who qualify for entry level 2 would graduate with a Master of Clinical Research by undertaking only Part A with the 48 points or credit points. So the criteria for level 2 entry are listed there in summary. So these would be students who obtain an equivalent of an Australian master's degree or an Australian doctorate degree or equivalent AQF 9 qualification in a relevant discipline and 2 years relevant work experience. And especially for Australian students, a common point of entry for level 2 are those people who are medically qualified and have got specialty training. So for example, the College of Physicians Part 1 training, so it has to be also registered as an Australian clinician. And this is becoming quite popular, in fact, because there are a lot of people who are training in clinical specialties, medical specialties, who need to do research on top as a capstone, if you like, of their training in a clinical area. And so they qualify for this. They still come out with a master's qualification, but only need to do the Part A of it. This really is a summary of the potential career options for someone who qualifies to the Master of Clinical Research. And as you can see, they are quite broad. On the left-hand side, it is just a summary of the type of areas that someone could work. Academia, obviously, someone in government, some government roles, the private sector, healthcare sector, and also related advocacy and non-government organisation roles. And many of you are probably aware of the prominence of clinical research in each of these industries. And on the right is just an example of the type of work that graduates can hope to undertake. At least in Australia, many of you might be aware that clinical practice does involve a lot of clinical research. Very large public hospitals tend to favour appointing people who have got clinical research backgrounds, obviously be a research-specific area or public health, or work in health policy and management. And really, the Master of Public Health would give you at least the basic skills to be able to work across all these areas. And in some areas, there would be requirement for further training, obviously, depending on the job. These are the contact details. I'm sure you would be able to find them easily on our website and elsewhere. If you have any queries, that's really it for me, Chloe, and I thank everyone for the attention.
Great, thank you. And I thought we've actually got Nat, who is a current second-year student in the Masters, and she's still with us. She's logged in externally. Nat, can you hear us? She might be on mute at the moment. Yep.
Hi, yes, I can hear you. Can you hear me?
Okay, I was just wondering, Nat, could you share with us perhaps a little bit about your background and why you chose the Master's program that you're in at the moment?
So I'm a clinical trial coordinator. So the reason that I chose the Master of Clinical Research is because I feel that it will be the only course that can address my curiosity with regards to clinical trials and clinical research, and a course that will be able to give me the skills to do my job better.
Oh, fantastic. And when are you looking to graduate?
So if everything goes well, I'll be graduating next year.
Okay, so you're currently doing the applied research units, are you?
Yes.
The Part B?
I'm doing the advanced, that's right. I'm doing the Advanced Health Practice Research unit, and that would be my final unit for this course.
Can you tell us a little bit about what you're doing, what your research is, what you like about it?
Well, at the moment, I'm still at the finding supervisor stage.
Mm-hmm.
So we're still not sure what research topic we'll be doing yet, but everything's going very well. I've received a lot of support from my course coordinator, which is Danny, and also from the supervisors. So we just need to organize the meeting, and then it's only in next semester then I would know what the topic would be about.
Okay. So are students able to put forward a preference for their research topic?
That's right, Chloe. So we would connect students to supervisors, and students would opt for, say, for example, tell us what they prefer doing or what their interests are, Chloe, and then we can link up someone as a supervisor to that student. And given our broad connections and wide collaborations, it's always easy to find the right project and supervisors for students.
Can we give a couple of examples
of
types of research that's been done in the past?
So Nat, for example, is about to speak to someone to a supervisor who's running a registry on myeloma and massive transfusion, so there's a hematological clinical registry, and so there's a lot of data there, Chloe, that Nat could analyse that is already pre-collected. I personally supervised an aged care physician from Adelaide and he had managed to obtain a lot of data from his particular hospital network, and he was tracking and following up patients who were referred to a particular aged care service, and he had the outcomes tracked for each of those patients, quite a large cohort, and we were answering a question of whether a particular intervention, a health service that was set up to manage aged care patients better, whether or not that actually worked in real life, so whether the intent matched the outcome.
So like a feasibility study?
It was more that actually, Chloe. It was a kind of evaluation of something that the hospital network had already started to see whether or not it actually did what it was supposed to do.
Yeah.
And then we've had also projects looking at the cost effectiveness of health promotion programs and the cost effectiveness of new medications for cancer. A very, very broad sort of range of topics, and that really keeps my life interesting.
Yeah, okay. I just had another question for you, Nat. Do you have any advice for people who are working and, balancing the study? Are you a full-time or a part-time student? We might have lost connection there. Are you there, Nat?
Yes, can you hear me? I'm sorry.
That's okay, you're back.
Forgot to unmute myself. Yep. So what I was saying while the phone was mute was, the advice that I have for any future student is that this course is the only course that I find that is available within Victoria that allows students to work full-time, have children, and, yet still be able to pursue further education. And so that alone is it's one of the main reasons why I took up this course. So because of that, the student has to be very self-motivated. There's not going to be anybody to hold your hand or tell you, oh, you have to study now or your assignment is due. So you do have to do your own readings, and you do have to be very self-motivated. Thank you.
Thank you. Did you have any questions for Nat before we open up to participants?
No, I don't. No.
Well, thank you very much for joining us, Nat. We really appreciate your perspective. I'm going to open up Q&A to our participants now. So we've already had quite a few come through. What do the relevant disciplines include?
Good question, Chloe. It's fairly broad, actually. Essentially, it's a health-related discipline or a clinical research-related discipline.
Okay. Great. What would examples of relevant work experience be in terms of applying?
Yep. So it would depend on the area that potential students are working in, Chloe. So a clinician obviously would be someone who has worked in a clinical environment for at least 2 years, a hospital or GP practice or a health community health service, but also research facility and a university, working in government or an NGO. It is really quite broad.
Great. So does the work experience need to be in a clinical setting?
No, it doesn't.
Okay. For Part B, will students need to find their own research projects?
So we touched upon this in the discussion with Nat. The short answer is no. If the student doesn't have a research project, then we find one for the student. If the student has a research project, then that's excellent.
Yeah.
And we just make sure that the project can be delivered within the time frame that's available and make sure that there's adequate supervision.
Great. What is the application deadline for semester 1, 2020?
So that's the 7th of February 2020, but I would encourage all applicants to apply well before the end of this year so that you can get a speedy response.
So applications are already open now?
Applications are open.
Okay, great.
And also I'd recommend that when you submit an application online that you submit all your documents at the same time.
Great. Are there any scholarships for this Masters?
So there's a scholarships webpage. So if you have a look at the Monash Uni scholarships webpage, there's a whole list of scholarships available, but I don't think any of them will cover all your course fees. But certainly have a look.
Mm-hmm. They're more sort of university-wide generic.
Yes.
So they would apply for those separately.
Yes.
Yes. Yes. How are the units offered? So are they on campus, off campus? A mixture?
A mixture, Chloe.
Yes.
So most of our units comprise I would say 80 to 90% online delivery. There are face-to-face teaching content delivered in block days, and by that we mean that students attend generally from 9 to 5 for those face-to-face activities, and for each unit typically there's 2 block days.
In a semester? In
a semester.
Is it normally towards the start, middle, end?
It does vary a bit, Chloe, according to units. So a lot of units have it near the start one day and then near the end one day, but then other units have it together.
Yeah.
Back to back. That makes it sometimes easier for the student if they're travelling from overseas, interstate.
Okay.
And can I just add additionally, so 3 of the core units, so epidemiology, biostatistics and research methods is also offered in a weekly face-to-face mode for those that would prefer it.
Okay.
Yeah.
Thank you. What if the student can't attend block days?
Generally, Chloe, we say that the block days are a compulsory component of the unit. Having said that, we understand that things pop up, and we have and always accommodate students who can't attend. I think the main thing is that students are able to catch up with the material that will otherwise was delivered on face-to-face in those block days.
Okay. Do you get sort of keynote speakers, or is there networking? So it's a really good experience.
Absolutely, Chloe. So I would say it's as much about the networking and that kind of immersion in something that's practical and rather than core content that is going to be examined, for example. Not to say there's none of that latter bit, but so for example, one of the units in clinical trials that I run, half of one of the block days is about a site visit to clinical trial centres.
Okay, fantastic.
Yeah, and students consistently say that that's good, that's a good experience. But the networking component is important as well, Chloe.
Well, and you're mingling with your peers who have all a variety of backgrounds and...
Exactly.
Yeah.
Yeah, and we do roll out the big hitters in clinical research, for students to talk to the key players in clinical research across Monash.
Fantastic.
Can I just add, since we're speaking about units, if you'd like to read up about the individual units, please do so in the handbook. That'll give you information on the assessment tasks as well. And then you can also have a look in the unit guide for this year, because next year's haven't been rolled over yet, and just have a look at the individual assessment tasks, the deadlines, to give you an idea of time management.
That's a great idea. Thanks, Maida. When will next year's roll out, roughly?
Normally, the unit guides don't roll out till about a week before start of semester, so probably midway through February.
Yeah, okay.
But certainly the handbook, the 2020 handbook online is available now.
Great. How much time per week should a student plan for Part A? They're enrolled in full-time study. How much, I suppose, contact hours, whether that's online or in person, plus self-directed study, should they allow per week?
We probably don't make a distinction between Part A or B. So across the course, generally the recommendation roughly for each unit is 12 hours per week.
Okay.
Chloe? And that would vary. I mean, some weeks are heavier than others, and obviously if coming to assessment or exam time, students probably might put in more hours than before other weeks, but generally about 12 hours a week.
So if enrolled in 4 units in full time, you're sort of looking at 40 to 50 hours a week?
That's correct.
Including self-study, contact hours?
Correct.
Yeah, okay. So it's quite a commitment if you're going to
Full-time, yes.
Yeah.
Yeah.
Is there any suggested reading for preparation before the course actually commences?
No, there isn't. I think we rely on the entry criteria to select people who are adequately, prepared for the course. No specific reading.
Okay.
There would be specific reading for certain units or certain topics within units, etc., but not generically.
Okay. So until week 1, you've got nothing to really worry
Yeah, other than maybe the postgrad handbook.
Yeah, great. What if a student doesn't have a master's or a medical degree, but they have extensive years of work experience? Could they be eligible for entry level 2?
No, generally not, Chloe. The entry criteria for 2 are quite specific.
Yeah.
And that's been kind of carefully chosen because the requirements, what we want someone who graduates in Master of Clinical Research is that sort of strength and capacity, knowledge and skills in clinical research. And without those entry or eligibility criteria, it is generally not something that we feel would give them that breadth and depth of skills and knowledge.
So that someone with that background would need to do the full Part A and Part B.
Correct.
Essentially.
Yeah.
Than that. Yeah. Thank you for clarifying.
Chloe, I might add too that going the other way is that what we're trying to do now or planning to do is actually to extend the Master of Clinical Research to be a 96 credit point master that's underway or planning.
And that equates to 2 years?
2 years, correct. And so the idea there is that then the people who come in, the students who come in would have less, can be less qualified, and then that whole 96 program will endow them with all the skills and knowledge they need when they come out at the other end.
Okay, great. We've had another question come through. Is entry level 2 limited to Australian doctoral degrees, or would it also apply to those from other countries?
It is Australian doctoral degrees and master's degrees, Chloe, and I think we would consider individual applications on a case-by-case basis if a very strong case could be mounted, that we consider would be equivalent, and we can consider that by and large would be Australian. Okay,
thank you very much. So that was our last question from participants. I'm just encouraging you all, still got a few more minutes here to type any questions you have through. Otherwise, we have, you will get a copy of the recording where you can circle back and look at the slides that Danny presented earlier, and certainly the contact page. You can always use the Monash 1800 number as well. But just giving you a moment there to type any last questions. Any last thoughts from us?
Can I just add, I mentioned the Monash handbook earlier. I'd recommend you have a look at it. So the course code is M6028. The course structure for both full and part-time is available in the handbook. The other thing, how to apply if you haven't already applied. If you go to the front page of Monash, find a course and just key in the name of the course or the course code. That'll take you to a little description about the course and then to the application web page. I'll just covered that.
No CSP places?
Definitely no CSP places for any of our postgrad courses, unfortunately.
You can get fee help. Yeah, they can still use the HEC.
Yeah. The other thing I was going to mention is the timetable. The timetable is available on the School of Public Health webpage under current students. At the moment, it's not available in the university timetable medium, but it will in the future. You can always contact us on the email address at the end of the slides, and we can direct you to the timetable. Is there anything else that we need to mention? Feel free, after this session, if you would like to contact us, and then, you know, if you've got any more questions.
They'll be fielded. Yeah. Was there anything else you wanted to add at this stage, Shelley?
Do it. It'll be fun. Good for your career.
Yeah.
We enjoy having teaching. It's really, it's great for us. It enriches our environment. So, from a purely selfish point of view, nothing else.
Yeah.
Chloe, we look forward to seeing you.
Fantastic. Well, thank you all for joining us. We've heard you got a lot out of today's session, but if not, do feel free to contact us. You will get a copy of the webinar recording in the days to come. So you can refer back to any of the information that's been provided and touch base if you have anything further. But thank you all for joining us.
Thank you.
Thank you.
Thank you.